Hi, my name is Molly Dunkman and I'm a SEMO nursing student. This is my medication administration video for my patient, Mrs. Jenkins. The 6 rights of medication administration are right patient, right drug, right dose, right time, right route, and right documentation. Before administering the medication, I need to make sure that the MARS and the physician's order align. The physician order states that warfarin 2.5 PO daily. Mrs. Jenkins Mars states that warfarin Coumadin 2.5 milligrams PO at 1800 each night. The Mars and the physician's order do match, so I can proceed. The important things to know about Coumadin before administering it are that it's an anticoagulant. This drug works by inhibiting hepatic synthesis of vitamin K, which then inhibits the clotting factors in the body. The reason I'm giving Coumadin to Mrs. Jenkins is because of her past medical history and her recent left hip surgery. Ms. Jenkins' past medical history includes atrial fibrillation, type 2 diabetes, and hypertension. All of these past medical issues put her at a high risk for blood clots and other severe complications. Side effects of Coumadin that Mrs. Jenkins could experience are hematemesis, which is vomiting blood, hematuria, which is having blood in your urine, ecchymosis, which is skin colorization caused by bleeding underneath the skin, petechica, which is smaller spots, also due to bleeding underneath the skin, and tarry stools, in which Miss Jenkins would notice her stools are very dark red or even black in color. If Miss Jenkins notices any of these, we would want her to let her nurse and the physician know. While monitoring a patient that is taking Coumadin, it is important to pay attention to certain lab results, 2 of those being the PT and the INR. At 0715 hours, Ms. Jenkins' lab results were recorded as a PT of 18 and an INR of 2.2. A patient who is normally not taking Coumadin would be expected to be in the INR range of 1.3 to 2. Since Ms. Jenkins is taking Coumadin, it is important to maintain her INR range to be in between 2 and 3. After reviewing this information about Coumadin, I am now going to enter the patient's room and administer the medication to Mrs. Jenkins. Before administering the medication, I would perform hand hygiene and then introduce myself. Hi, Mrs. Jenkins. My name is Molly, and I'm a nursing student at SEMO. I'm going to be administering your Coumadin today. Before administering the medication, I'm going to make sure that the patient is in a safe and comfortable position. Mrs. Jenkins, do you feel comfortable?
Yes.
Okay, good. To assist with swallowing, I can elevate the patient's head if I needed to, and then next I'm going to ask Ms. Jenkins if there's any preferences as to how she wants to take her medication. Would you like to take your medications all at once or individually?
All at once, please.
Okay, great. Next, I'm going to identify her name and date of birth and then ask if she has any known allergies. Can I get your name and date of birth?
My name is Mary Ellen Jenkins, and my birthday is August 14th.
Okay, perfect. Do you have any known allergies?
Penicillin.
Okay. I also want to assess her pain level, and I also noticed that yesterday in her orders she complained of having nausea, so I'll need to ask about previous or current adverse effects while taking this medication. Mrs. Jenkins, how would you rate your pain on a scale of 1 to 10, 1 being the least, 10 being the most?
6.
Okay, great. Have you experienced any side effects or anything since starting this medication?
No.
Okay. Now that I've done all this, I would explain to Mrs. Jenkins and her family about Coumadin, why she's taking it, and if there's any potential side effects to look out for. Okay, Mrs. Jenkins, so Coumadin is an anticoagulant, and it works by interfering with blood clotting by inhibiting the synthesis of vitamin K. The reason that you're taking this medication is because of your past medical history, which includes atrial fibrillation, which is just an irregular heartbeat, hypertension, type 2 diabetes, and the reason I'm giving you this medication is because I want to decrease your risk of experiencing a blood clot and other complications after your surgery. The next thing I want to do is I want to explain some side effects for Mrs. Jenkins and her family to watch out for. Some common side effects of this include hematuria, which is blood in your urine, hematemesis, and this is just vomiting in your blood, and you may also want to watch out for tarry stools, which is either dark red or black in color, and you may also want to watch out for any colored spots or patches on your skin, which would be bleeding underneath. After explaining this, I would ask Ms. Jenkins if she has any questions about the medications. Do you have any questions about the medications?
No.
Okay, perfect. Now I want to explain some dietary considerations for this drug. Ms. Jenkins, while taking Coumadin, you want to avoid aspirin because it can cause an effect with this drug. And it also, if you have foods that are high in vitamin K common in your diet, like leafy green vegetables, you'll want to remember that those can decrease the effect of the drug as well. Now, after explaining, as long as Mrs. Jenkins and her family have no further questions, I can begin the process of administering the medication. Do you have any further questions?
No.
Okay, great. Now I'll start my 3 checks of the medication administration. First, I'll get the medication from the dispenser, and I'll check the bottle and the label with the MARS and the physician's orders. Then I can dispense my meds into the wrapper, and then I perform my second check again, just noting that it still says Coumadin 2.5, and that is what I have. And then I will complete my second check when I am at Mrs. Jenkins' bedside. So before giving Mrs. Jenkins the medications, I will note that it's 2.5 and 2.5 is what I have while I'm at her bedside. And then since I've completed all 3 medication checks, I'm now going to administer the medication to Mrs. Jenkins. And then I note that earlier she said that she wanted to take her tablets all at once, so that's how I gave it to her. And then I will also provide her with a glass of water to assist with swallowing. And then I would give Mrs. Jenkins some time to take her medication, and once she's done, I'll assess for any swallowing difficulties and make sure that she's taking the medicine completely okay. Okay, Mrs. Jenkins, did you have any difficulty swallowing?
Nope.
Can you open your mouth so I can check that you did your medication? And then before I leave the patient's room, I will make sure that she's comfortable and in the position that she would like. Are you comfortable and in the position you would like?
Yes.
And I would make sure that her bed rails are up and her bed is lowered to the ground for safety. And then now that I've done this, I will put the medication back, everything away. And then before I would exit the room, I would go and look at my MARS record and document that I gave her Coumadin 2.5 PO at 1800 hours. And then once I documented my medication, I would come back in about 30 minutes and check on Mrs. Jenkins for any side effects or any discomfort, as well as monitoring her vital signs and her lab results such as PT and INR. My name is Molly Duckman, and this is my medication administration video. Thank you.